Well, specifically when we use drug-coated balloons, we want to get a perfect, ideally stent-like procedural result, but in fact without implanting any permanent device. So that means we need to get to a perfect luminal gain, and we need to minimize dissections. These are, I think, the most important challenges prior to the kind of delivering the drug to the vessel wall. There are multiple ways. Classic atherectomy procedures typically have the disadvantage that they are relatively complex, time-consuming, and also costly. So alternative therapies like scoring balloons and similar devices, or also high-pressure dilatations, are of interest. Because they potentially can achieve a similar result, but in a more ergonomic way, specifically in calcified lesions and CTO lesions with a lot of rigid plaque material. I think this is where these technologies are important, and this is where we use them in clinical practice. Well, I mean, the ULTRASCORE is one of the scoring systems which is for a relatively long time available, so we have very good experience with it. Recently, there was an upgrade of the system. It now tracks over an 035 wire, which is helpful, and it has kind of pre-established two fixed wires on the surface, which makes it an effective and easy to handle tool. One of the key advantages is that this device is available also in long balloon lengths, which is very suitable for long CTO lesions, because CTO lesions in fact are usually very frequently long lesions. Well, I think it's a device which is specifically designed to achieve optimal vessel preparation. With the wires on the surface, it transitions the dilatation force in a much more focal way to the plaque. So it's I think a 24 times increased force which we are observing, that results in potentially better controlled fracture of the plaque, which just makes the vessel more compliant, avoids dissection, and improves luminal gain. We have been using the ULTRASCORE technology for many years now. The initial device, which tracked over 014 wires, was already a very usable device. To me, particularly the availability of long balloon lengths made it very applicable to many patients. So now the upgrade also allows that this device tracks over 035 wire. It is improved in performance, so I think it's really even better usable for more patients in the future. The main challenge of chronic total occlusions remains the plaque burden and in different extent the calcification. So we need to have effective solutions who address this specific challenge. Vessel preparation with ULTRASCORE is one of the options, which can be used in many cases. So I think that will help a lot in the future to get better results with CTOs.